Hello, today is April 3rd, and I thought I'd do a quick update on the worsening epidemic in Turkey. I posted a video, I believe on April 1st, which had data through the end of March 31st. I've just gotten today's numbers, April 3rd, so I have the first, second, and third, and I'm going to do a quick update. As you'll see from the Johns Hopkins dashboard, Turkey now is over 20,000, almost 21,000 cases, and has over 400 deaths. The health minister confirmed, of course, that there's been a large increase in cases. 2,786, I believe, is the largest increase that Turkey has seen, and Turkey has had trouble keeping up with testing. They've only been able to do about 100,000 tests so far, compared to Italy's 500,000, and they are only able to do a little bit more than 10,000 tests a day right now. And they probably need to be doing 2 or 3 times that to be able to really track the cases. They also point out that 1,250 patients are in intensive care. We know once we get into intensive care, it's a very difficult disease to beat. Ventilators, people talk about as being super important for saving lives. They do save lives, but if you need a ventilator, you're in very bad shape and you may not survive. It's not a panacea. It doesn't work. It doesn't work a lot of the time because it's just too difficult a disease to beat. So this is the information about the tests they've conducted. Another thing that we've learned is that 600 healthcare professionals have been infected across Turkey. Remember, the epidemic in Turkey is about 3 weeks old as far as we know. So that's a really significant number of healthcare workers, frontline, important, necessary healthcare workers that are being sidelined with the disease. The government in Ankara has called for a full some people have called for a full lockdown. The government so far, and President Erdogan has said, no, we must keep the economy's wheels turning. I said last time there's going to be a tremendous cost in lives if you're not careful and keep the economy turning at the expense of slowing the disease. This outbreak, I think, is no longer in the early stages, and simple things like washing hands and asking people to practice social distancing isn't going to be enough. Turkey must do more aggressive measures to halt movement of individuals and aggregation of individuals, and make sure that people stay apart, stay in their house, and try to slow this thing down. So here's the 2 big money graphs. This is the first of 2. This is the graph on the left is exactly what I showed you on April 1st. So I'm showing you Italy, Spain, the U.S., and Turkey, and the number of cases in days after those countries reached 10 cases. And you can see that Turkey was growing extremely fast relative to Italy and Spain, but we saw that the U.S. had this tremendous spike around day 15 that it was unlikely that Turkey was going to see. Well, we've added these 3-day cases right over here. That's April 1st, 2nd, and 3rd. And so what we see is, as I expected, Turkey is increasing steeply. These are those same dates for Italy and Spain. If you look up straight up and down here, I'm looking into my computer to show you how straight up and down it is, sorry. But the U.S. is quite far up here. So I don't think that Turkey is going to keep pace with the U.S., which is good because the U.S. had a tremendous growth in cases at that point. But I do think it will outgrow Italy and Spain. Well, what does that mean? Well, Italy had 15,000 cases. Italy had 36,000 cases. Spain 58,000, and the U.S. 83,000 after they crossed the 15,000 threshold. Turkey, as I said, is now over 20,000, and we've got 5 more days. 5 days at growing at 3,000 would be 15, would be about 36. So I think the best they can hope for is to be as low, if you can call it that, as Italy. But I think that they're going to grow faster than that, and I think this is probably even now an underestimate because of the trouble with keeping up with testing. So I do still expect Turkey to have around 70,000 cases in 5 days from now on April 8th, although I don't know that we'll be able to document that. I don't know the data will show that on the 8th because I'm not sure that there'll be enough testing to be able to document that. So moving now to deaths, unfortunately through April 3rd, Turkey was trailing Italy, but ahead of Spain and the U.S. Italy had a much higher fatality rate than other countries early in their epidemic. what we see is that Turkey continues to sort of stake out a middle ground between Italy, Spain, and the U.S., although I think the slope was more like the U.S., and I think Spain grew very quickly as well. I think those lines to cross in a few days, and I don't think Turkey will have as many deaths as Spain did, although it's possible. I mean, with 1,000 plus people in intensive care, that means there's a lot of individuals who are sick. So 1 week after crossing the 15,000 case threshold, Italy had 3,000 deaths, Spain 4,000, and the U.S. 1,200. So 1,200 is the lower bound, it looks like, and if Turkey continues to stay above that blue line, it will beat out 1,200. I don't think it'll get up to 3,000 or 4,000. So I still expect Turkey to have about 1,200 deaths on April 8th. So I think both of my predictions from a couple of days ago seem to be panning out. So that's the good news and the bad news. So the bad news is the epidemic really is accelerating as we feared it would, as it has in most other countries where it's gotten into communities, into dense cities, and so forth. So please do what you can to stay healthy. And I hope you and your family are safe. Have a good week if you can.